Hello everyone, we're Group 4 and we will be presenting about the mental health issues of the elderly population in Canada. Mental health is defined as the capacity of individuals to interact with each other and their environment in ways that enhance or promote their sense of well-being and of control and choice with their life. It also promotes optimal use of their mental abilities, achievement of their own goals, and their quality of life. According to Canadian Mental Health Association, in 2008, adults over the age of 65 constituted 13.5% of the total population in Ontario, which is equivalent to 1.7 million. By 2036, that figure is expected to rise to approximately 23.2% or 4.1 million. Incidence and prevalence. It is estimated that the prevalence of mental health problems in adults over 65 years ranges from 17 to 30%. In total, that means that between 289,000 and 680,000 older adults are affected by mental health problems in Ontario. Recent studies show that 80% to 90% of residents in long-term care settings suffer from some form of mental disorder. 15 to 25% are severely impacted by major depression. The most common mental illness after age 65 are mood and anxiety disorders, cognitive and mental disorders due to a medical condition. This includes dementia and delirium, substance misuse, including prescription drugs and alcohol, and psychotic disorders. Mental health problems and illnesses among older adults are likely to affect every family in Canada in some way. If left unaddressed, the increasing pressure on the healthcare system will have significant social and economic impacts. The following are principles for promoting and supporting seniors' mental health. These core principles reflect the seniors' shared values and are meant to guide healthcare providers and the government in providing interventions and programs that promote seniors' quality of life and well-being. First one is respect and dignity. It is being treated with respect regardless of the situation and giving them a sense of self-esteem. Second is self-determination, independence, and choice. It is by giving them control of their lives and being able to do as much for themselves as possible and letting them make their own choices. The third is participation, relationship, and social inclusion. It is by allowing them to get involved, stay active, and take part in the community. It also involves being consulted and having their views considered. The fourth is fairness and equity, which means having equitable access socially, economically, and politically to available resources and services, not being discriminated against on the basis of age, and being treated and dealt with in a way that maximizes inclusion of seniors. The last one is security, which means having adequate income as one ages and having access to a safe and supportive living environment. The impact of determinants in late adulthood. The social determinants of health are broadly accepted as being relevant to physical health as well as mental health. Physical changes and chronic health conditions can have substantial impact on the psychological and social well-being of older adults by, for example, reducing opportunities for social engagement and relationships and their associated benefits. Pressures from the environment that affect the majority of seniors include retirement, changes in income level, and changes in social support networks, including caring for another individual and coping with the death of a spouse and peers. The preceding events may negatively affect seniors' mental health by increasing social isolation, loneliness, depression, and suicidal thoughts, and may impact each other depending on the availability of appropriate individual and social resources when needed.
Mental health disorders in older adults are the following: depression, suicide, anxiety disorder, dementia, delusional disorder, delirium, paraphrenia, and concurrent disorder. Depression. The prevalence of seniors with depressive symptoms is reported to be 10% to 15% in Canada. Many seniors service providers and many older adults themselves believe these statistics to underrepresent the situation. Some of this may be due to the practice of reporting only what is assessed as clinically significant depression, as opposed to what older adults experience as a seriously disabling condition. Even if only 10 to 15% of older adults are dealing with the effects of serious depression, this accounts for 225,000 older adults in Ontario in need of services and supports for this treatable condition. The CMHA points out that depression in seniors is one of the most common mental health problems affecting seniors, but is often underdiagnosed. As with other age groups, there are significant differences in prevalent rates of depression between older women and men, with women experiencing almost twice the rate, 14.1%, than that reported for men, 7.3%. Recent immigrants are at particular risk due to increased social isolation. Depression in older persons often goes unrecognized. The Canadian Mental Health Association of 2002 suggests that older persons may not seek help because they see depression as a normal consequence of aging or of losing independence, believe treatment would be too long-term or expensive, have depressive symptoms such as problems with sleep or appetite, diagnosed as signs of a physical illness or ignored entirely, already have other physical or mental illnesses, such as dementia or diabetes, and may not distinguish depression as a separate illness that can be treated, experience depression as a side effect of medications, such as some drugs for high blood pressure, feel embarrassed or ashamed to discuss it, are living with a constant low-level form of depression known as dysthymia, so may not even recognize it or think it can be treated, have not experienced any life events that could have brought the depression on, and so feel it must be a personal flaw, lack mobility or family support to seek professional help, come from a culture that holds different perceptions about what depression is. Identification and diagnosis of depression can be a challenge, particularly in the elderly, leading to underdiagnosis or misdiagnosis. Common barriers include communication limitations such as hearing impairment, presence of dementia or cognitive impairment, interfering with accurate reporting of symptoms, social stigma, poor understanding of normal aging changes versus illness, lack of screening targeted at high-risk groups.
Suicide. Untreated depression and lack of social supports are considered major risk factors for suicide among seniors. Suicide is often considered one extreme indicator of depression. The population of older persons with depression experiences a suicide rate which is 5 times higher than that of any other age group. Older men are at especially high risk for suicide. Approximately 1,000 older adults are admitted to Canadian hospitals each year because of intentional harm, but it is unknown how many older persons have harmed themselves and are not hospitalized. Of note, the lethal potential of self-harm behavior increases with advancing age. Hanging and firearm were used the most means of suicide in older Canadian men, while the most common methods for older women were poisoning and hanging. It is widely believed that self-harm and suicide rates for seniors are underestimated in Canada. Anxiety disorder. Both health providers and older adults themselves often dismiss anxiety symptoms as worrying too much. In fact, up to 1 in 4 adults experience an anxiety disorder sometime in their lifetime, which may include phobias or panic, obsessive-compulsive or post-traumatic stress disorder. Among 20% of people over age 65 had an anxiety disorder in the past 6 months. Anxiety disorders are the most common mental health problems in women. Among men, they are second only to substance use disorder. Dementia. Canadian statistics reveal that people are more likely to develop dementia as they age. Thus, as the percentage of persons over 75 years grows, more individuals and their families will face mental health and addictions problems. Dementia is found in 2% of Canadians 65 to 74 years of age, 11% of Canadians 75 to 84 years of age, and 35% of Canadians 85 years and over. Delirium. Delirium is considered a medical emergency. Delirium has been described as the most common and potentially reversible lethal mental health disorder of the old age. Delirium is generally a reversible mental health disorder but can have serious implications if not diagnosed and treated. It is usually precipitated by a physical illness or drug use. In many cases, delirium is not recognized or is misdiagnosed as another conditions such as depression or dementia, resulting in long-term consequences. In fact, it has been reported that delirium occurs in up to 50% of older persons admitted to acute care settings and in 22 to 89% of older persons with pre-existing dementia in hospitals and in the community. Delirium can occur as a consequence of the medical conditions, substance intoxications, substance withdrawal, or due to multiple etiologies. The occurrence of delirium is not inevitable and can be treated. It is estimated that 13% of all hospitalized older adults develop delirium. Delusional disorders and paraphernalia. In the past, most of the research into schizophrenia focused on younger adults. It was partly due to the fact that few people suffering from schizophrenia live into older age, falling victims to suicide or lifestyle issues associated with this devastating disease. With better treatments and supports, more people with schizophrenia are living longer, and although few statistics are available to describe this population, there is now an increase in the attention being given to older schizophrenic patients, including those with the late onset of the disorder. Delusional disorder and psychotic depression are more likely to have onset during middle age and old age than during early adulthood.
Concurrent disorder. While little research has yet focused on concurrent disorder, specifically in older adults, substance use in this population is of great concern, and there are certainly relationships with mental illness for many seniors. Alcohol is the most common substance misused by older adults, and alcoholism is often hidden, denied, or unrecognized. Alcohol abuse is estimated to affect between 5% and 11% of seniors. Men over 65 years of age tend to drink alcohol more frequently than women over 65 years of age. And one third of older adults with a drinking problem begin misusing alcohol after they reach old age. Older people who are depressed are 3 to 4 times more likely to have alcohol related problems than are older adults who are not depressed. Between 15 and 30% of people with major late life depression have alcohol problems. Concurrent disorder, substance abuse. Substance abuse among seniors may also involve prescription or non prescription drugs. Substance misuse may be significant as substance abuse as some seniors forget to take their medication or share medication with others. Some may also have self medicate, try to treat their medical condition on their own by taking more or less of medication than prescribed, or by taking medication not prescribed. Concurrent disorder, gambling. Older persons may resort to gambling as a way of getting out and socializing and avoiding loneliness or boredom. Gambling is actively promoted by casinos, which offer buses to pick up older persons up from their nursing or retirement homes. While the rate of gambling of per person 60 years of age and older is relatively low compared to general population. According to Canadian Mental Health Association, to address the needs of all older adults, a framework must be developed that includes a continuum of education, care, and support that will enable people living in the community to live their lives to the fullest in the spite of challenges of mental illness or addiction. Core elements are community-based care, collaboration across all sectors to deliver a social model of care, recovery-based approach that involves the client and family, career involvement in system planning, implementation, and evaluation. Strategies and interventions. Act early. Prevention. Support for community-based social support network by seniors for seniors. Research has shown that psychosocial intervention, such as a social network, facilitated education programs that help seniors build on their strengths, maximize their potential, and optimize their physical wellness and peer support work and play a role in preventing age-onset depression. Expand family health team services to include home visits, nurse practitioners focused on frail elderly. The importance of accessible and responsive primary care is essential in the prevention of mental health problems in older adults. Expand community-based support to enable seniors to continue to live at home. Home visits to the frail elderly, nurse practitioners for community-based primary care, and expanded community-based support to enable seniors to live at home are all excellent strategies for creating environment conducive to good mental health and should be expanded across the province.
Act early. Prevention. Support for community-based social support networks by seniors for seniors. Expand family health team services to include home visits. Home visits are very important to seniors, especially if they do have mobility issues wherein getting from point A to point B would be quite a challenge, or for some seniors who does have cognitive issues wherein getting around the city or getting to their healthcare provider might be a problem. So home visits gives them that chance to be looked after and to be heard, or even to be to feel that they're being taken care of by the healthcare team. Expand community-based supports to enable seniors to continue to live at home. A lot of the seniors in the community don't want to move anywhere else, especially if that's where they grew up or that's where they lived for the last 20 years. So home visits do really play a great role in making sure that we are taking care of our elderly, especially with those who are have ongoing mental health issues. And it gives them the sense of that safe place as well, considering that they're being looked after. Meeting people in their own terms. Research has proven that treatment is more effective and clinical outcomes are more positive, and client satisfaction in the experience is much greater when the treatment approach is recovery-based and person-centered. Good mental health requires that the social determinants of health, including affordable and appropriate housing in their own community, adequate income, education, social networks, and transportation are present. I'm currently working as a mental health nurse case manager in the community, and I have seen a lot of cases wherein elderlies are struggling with their mental health issues, as well as the social determinants are also a pressing challenge into their current situation. And as a healthcare provider, you really have to find the balance between being able to advocate for them and make sure that they're getting the help that they need, and at the same time use a collaborative approach wherein they still feel and they still are in charge of their own healthcare decisions. As healthcare provider, what we can do and the key strategies would also be to be able to establish additional services for seniors with concurrent disorders. Most of them live alone and they need that social support, and sometimes they don't even know where to start. So a lot of mental health community services are actually available, and sometimes it's just a matter of being able to find the right resources for the elderly population who are suffering with mental health issues. Transform the system. Key strategies. Helping older adults to remain at home. To support older adults in the least restrictive, most natural environment possible to achieve good quality of life. And one way to achieve this is case management, or specialized case management. Personally, I feel that case management really works for the elderly population, especially those that decide to stay at home, because for them, home is a safe place and it's a very familiar environment for them. And with case managers, they help advocate for the client, they help them out with their appointments, and there's also that trusting relationship between the client and the case manager. Avoiding ER visits and hospital admissions. Busy emerge tends to further agitate a senior who may already be confused and aggressive, and one way to combat this is to establish a crisis response service for seniors with mental health issues. It is recommended that province-wide 24/7 crisis services for seniors with mental health and addictions issue be established to provide immediate attention and assess clients' needs. A lot of the community health services do have coaching lines wherein they can call for help if they feel that they're anxious or they're agitated. They can call their nurse case managers anytime or whoever is on call to help them cope with their current situation, to give them strategies that might be helpful for them at that period of time, to help them take in charge with their own health care. And this also prevents them from going to the emergency room for unnecessary visits. Strengthen the workforce. Training the workforce to enhance knowledge, decrease discrimination, and increase and share best practices are essential elements for strengthening the mental health and addictions workforce. Key strategies for strengthening the workforce is training. A part of training is to support community-based education for workforce in aspects of seniors' mental health problems ranging from normal aging, anti-ageism, early identification, treatment, and support. Toronto Hostels Training Center offers practical, financial, accessible training curriculum for shelter, housing and drop-in staff, and nurses. Some of their workshops include diffusing hostility training, nonviolent crisis intervention training, mental health first aid, and there's just a lot of workshops that I find that are beneficial for healthcare providers and for us to be able to care properly for the elderly population who are suffering with mental health issues. And also, as a parting shot for this segment, is that awareness plays a great role for us healthcare providers and for us to be able to provide competent care. It starts with ourselves. We have to be aware with our own values. We have to be aware of our own stigma towards mental health for us to step up our game and care for everyone unbiasedly. Early identification and prevention. Education for the public, specifically seniors and service providers, and ageism, discrimination and normal aging versus mental health problems. We all know there's still a lot of social stigma attached to mental health issues, and what makes it more challenging for elderlies with mental health problems is that there's really a fine line between knowing if it's just a normal process of aging or they're starting to show or exhibit signs of mental health issues. So one part of it is education for the healthcare providers, for us to be able to properly screen them and to have that tool within us to be able to identify the normal parameters, whether it's something that needs to be acted upon.
Number 5. Stop stigma. Stigma and discrimination can exist amongst the public, families, service providers, and consumers themselves. There are key strategies to stop stigma: public awareness, service provider training to decrease stigmatizing attitudes for mental health workforce as well as other public service sectors. Another training is community-based by seniors, for seniors and their caregivers on normal aging, about the effects of ageism, discrimination, and early signs of mental health problems. Support for printed resources or credible web-based information on aging and mental health. Number 6. Creating healthy communities and building community resilience to mental illness and addictions. The social determinants of health are broadly accepted as being relevant to physical health as well as mental health. Measures that are taken to foster the overall population health of a community must include factors that nourish social inclusion, affordable housing, adequate income, good transportation, and opportunities for recreation and exercise. The whole of government approach, a cross-sectoral involvement led by the Ministry of Health and Long-Term Care to address the health and social factors of mental well-being. Housing, expand available supportive housing for seniors with mental illness, and establish transitional services to facilitate reintegration of seniors from hospital back to the community. Community services. Extend services linked to supportive housing into the community to prevent at-risk seniors from becoming homeless. Expand community services for seniors with mental illness and/or addictions to assist them in living at home. Define and fund the role of community care access centers in caring for older adults with mental ill health at home. Transportation. Affordable, available transportation is necessary to enable seniors to access mental health as well as social and recreational activities.
What are the challenges as a community mental health nurse for older adults?
One of the challenges that I find is trying to communicate with the clients, because sometimes if you're trying to plan a visit with them or see how they are, you go to their door, sometimes they don't even answer your door. They're because of mobility issues or because of their cognitive function. They forget that you have an appointment that day, and then you try to phone them and then they can't answer the phone. So just trying to communicate with the patient, trying to set up an appointment would be one of the most common challenges in older adults that has mental health issues.
Mental illness is health. Mental health problems, including depression and other mood disorders, are among the most prevalent and serious health problems among older adults. Care systems need to be community and outpatient oriented and to include proactive collaboration between treatment systems. Mental illness should be given the same priority as any other illness. Community mental health in nursing is the application of knowledge of psychiatric nursing in preventing, promoting, and maintaining the mental health of the people, and to help in early diagnosis and care, and to rehabilitate the client's one's mental illness. There are activities such as public education programs, prevention approaches, and the provision of mental health services that help to improve the mental health status of older adults. It is important for community health nurses to identify the underlying roots of various health concerns and plan actions that are realistic, non-judgmental, holistic, and positive.
Here is a list of our references that completes our presentation. Thank you all for listening, and we hope you enjoyed our presentation.